And thanks for staying with us. President Biden urging the millions of Americans who are now eligible for a Pfizer booster shot to go get that added protection against COVID-19.
This comes as CDC Director Dr. Rochelle Walensky signed off on a series of recommendations made by an advisory committee, but added her own twist, agreeing that boosters should be offered to people 65 and up and people 18 and older with underlying health conditions. But she also put back in the FDA's recommendation for a booster for people whose jobs might put them at risk, such as healthcare workers.
As CDC director, it's my job to recognize where our actions can have the greatest impact.
Moderna is in the process of seeking FDA authorization for a booster shot, and Johnson & Johnson is expected to follow suit soon.
Well, that decision created a lot of questions for you and us as well today. Namely, who exactly falls into that category of working a job that puts them at risk?
Talil Moladin worked to get some answers on that, and she's in the studio now with what we learned. Talil?
Hospitals, pharmacies, and health departments are taking different approaches to these new guidelines. At SSM Health, there's plenty of Pfizer ready to go for booster shots. But VP of Pharmacy Services, Mo Carbat, wants to know more first.
To define what does it take for someone to prove if they have an underlying condition? Do they have to prove to bring a medical record, or they can just perhaps sign a test?
He's glad the CDC authorized boosters for millions of Americans, including people aged 65 and up, people in nursing homes, and those with pre-existing conditions. But he also wants more guidance on who falls in the category of working a job that puts them at risk of getting sick. That would come from the state health department.
They add more details to how to operationalize a certain service or a vaccine or a drug product. In this case, with booster shots for the COVID vaccine.
Late Friday, DHS Secretary-designee Karen Timberlake issued a statement asking for patience while the department processed the CDC's information. Public Health Madison and Dane County said it's also waiting on the DHS, adding, "We currently do not have boosters available as we are required to wait on further authorization and guidance from the state health authorities." But not every vaccine provider needs to wait. Pharmacies such as Walgreens, CVS, and Hy-Vee are already offering the booster.
We're a federal retail pharmacy partner with the CDC. We order directly through them. And the CDC has plenty of Pfizer vaccine to accommodate booster doses.
That's allowing certain people to decide for themselves if they're high risk either medically or at work.
Yeah, we're asking people to be honest, right? And so the CDC is putting, the impetus on the patient to determine if they fall in those categories.
People looking to get the booster shot should keep in mind that they would have needed to have received the Pfizer's primary series. Dose 1 and 2 first. Moderna and Johnson & Johnson vaccines are expected to be available as early as later this year.
And we are continuing to keep you updated on the latest information about those COVID boosters, including where you can go if you want to get yours. We also have a list of answers to the most commonly asked questions about boosters on our website, channel3000.com.